All right. Hey, you know what? It's 6 o'clock. Actually, 6:01. And I'm calling the meeting to order. Shall we stand and say the pledge?
Yeah.
And the flag is right in that corner there. And Neil, will you lead us in the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America, and for which
it stands.
one nation, under God, indivisible, with liberty and justice for all. How'd we do?
It was better than usual. Okay. So,
We just want to double check, Bill, that everybody is muted except for members of the board until you're called upon to speak. Correct? Looks like.
okay. So the first order of business are minutes. And we have 2 minutes. The first one is the July 13th, 2020 work session meeting minutes. Everyone
I
has,
move to accept the minutes as written.
all right.
I second.
Okay, Zach moves, Mary Ann seconds. Any discussion? Seeing none, Zach, your vote.
Aye.
Sorry. Mary Ann,
Aye.
Neil,
Aye.
John,
Aye.
Bill, aye. Ayes have it. And the second order of business is the July 13th, 2020 regular meeting minutes.
I make a motion, we accept the meeting minutes as written.
Okay, Mary Ann moves. Is there a second?
Second.
All right, Neil seconds. Any discussion? Seeing none. Zach, your vote.
Aye.
Mary Ann,
Aye.
Neil,
Aye.
John,
Aye.
Bill, aye. Ayes have it. And minutes have passed. The select board will meet on the following dates. We'll have regular meetings at 6 p.m. on Monday, August 10th and August 24th, 2020. Work sessions prior to the regular meeting will start at 5 p.m. Citizens wishing to be listed on the select board's agenda should notify the town hall before the Friday before the scheduled meeting. Reopening of town offices. In keeping with the governor's new orders and after discussion with the Plymouth Emergency Management Director and the Plymouth Health Officer, the reopening of town offices has been moved to August 24th, 2020. Town employees are still available to the public during regular business hours. You can call to have your questions answered, to make an appointment with any office, or continue to email us at townhall@plymouth-nh.org. Selectmen's office is Monday through Friday, 8 a.m. to 4:30. Their number is 536-1731. Town clerk's office is also open Monday through Friday, 8:30 to 4 p.m. And their number is 536-1732. Tax collector's office is Tuesday through Thursday, 8 a.m. to 2 p.m., 536-4733. And as usual, we thank you for your continued patience and support during this time. I have no comments. And Joe, you're up with a new purchase order.
Okay, so I have a repair we need to do to our excavator. And we put it on hold. We've had this since we were in a freeze since winter. So anyways, our machine won't run right. It's to do with the emissions. And so I got a quote to fix it. And the part's rather expensive, so the whole bill's $5,314.55.
I have a question. Is that electronic fuel injection?
No, it's the emissions. It's just something that we're plagued with. So without fixing
computer?
it. Part of it, yes. Yeah, it's electronic and fuel. It's kind of a mixture.
Did they do a diagnosis?
Yes, correct. Part of this bill shows the diagnosis, which was $760 to have them come up and look at it and diagnosis. So yeah, yes, it's not a shot in the dark. They actually know what's wrong with it.
That's good.
Do we ever get any other estimates, Joe?
Unfortunately, it's Chadwick-Baross is the only Volvo dealer, and so they're locked into the. I wouldn't take it to another dealer because that's what they do. I kind of locked into this one dealer.
Any other questions? Seeing none, is there a motion?
I move that we approve this repair on this excavator.
Okay, Neil moves. Is there a second? Zach seconds. John, your vote?
Aye.
Neil?
Aye.
Mary Ann?
Aye.
Bill? Aye. Zach?
Aye.
Good, the ayes have it. Well, thank you, Jeff.
All right. Thank you.
And maybe just a reminder too, if you haven't done this, to go into town hall and sign these once they're approved.
Oh.
All right. Now we got 7 minutes to.
You can bring Juliet
Yeah.
Harvey Bolia up. I can be quick.
Okay. Sure.
All right, thank you. This is regarding the draft memorandum of understanding between the town and the Plymouth Village Water and Sewer District with regards to what we'll refer to as the Big Dig. The purpose of this memorandum is to define in general terms the working relationship between the town and Plymouth Village Water and Sewer District, which is a separate municipal entity. Both the town and the Plymouth Village Water and Sewer District will be seeking storm drainage infrastructure improvements in the downtown area beginning in 2021. And so we both want to advance the project and to receive grants to fund the improvements. But because we have separate budgets between the two entities, we're using this document to define where the town's responsibility ends and Plymouth Village Water and Sewer District's part of the project begins. If you want to, as a board, look over the document, it's general, and we don't get into specifics because we haven't gotten into any formal sort of planning. But if you'll notice under key aspects of this MOU include the next 3 items allow for sort of an out in case we don't get grants and the project on our behalf doesn't move forward. So, for instance, it says under the first one, the town's EDA grant application is completed and submitted in time for review. So by December 31st, we have some specific things here that it calls for. And if they don't happen, then we're not really going forward. So it's not really a committed, something we're committing to. It's more just sort of defining what we expect out of this project. So that's why I feel pretty good about the document in general. I think it's kind of spells out what we wanted it to say and what they wanted to say. Did everybody have a chance to look at it?
I did.
Susan, why not make it official? What's the issue around that? Seems like we should have an understanding from each of us.
Yeah, and it is. But like, for instance, we haven't been formally approved for a planning grant yet. So And then after that, we still have to get the grant from the EDA for the bulk of the project. So if we don't get those things, then obviously we're not really going to have much of a project at all. So that we're just spelling out. Does that make sense?
So this MOU, is this just for the project or just as a general, here's how we work together?
Right, the second one. It's just
Okay.
sort of, we had a little bit of, we wanted to spell out, first of all, we had some questions about where the pipes and the drainage overlap in town. Who's going to be responsible for that cost and how are we going to divvy up that cost? Well, this lays the framework to continue with that when and if we get to that point. Those
Okay.
sort of, it's just more or less housekeeping.
Sure.
Yeah, so it's just sort of like an introduction to further agreements that will come down the line.
Yeah, no, seems like a good idea.
Jules, is this timeline good with the town engineer in order to prepare those two reports?
Yes, I mean, they're already sort of anticipating it because they've been working with Plymouth Village Water and Sewer already. In fact, they have their engineering. So if you're talking about Wright Pierce, they're already kind of preparing for it.
So we feel confident that our obligations in the MOU are stuff that we can fulfill.
Correct, and it's not really, there's really not much here that we.
It's a protection, Zach. It's a protection for the town. It makes it very specific that we're responsible for one part, like the stormwater drainage, and Plymouth Village Water and Sewer is responsible for the sewer and water. So that we don't get charged for their stuff, they don't get charged for our stuff. It's just a protection we're trying to put in place.
Yeah, and like it says here somewhere, we'll be meeting on a regular basis when and if we get approved, and we're moving along to iron out some of these difficult areas. And I think, communication being the key to a good relationship between us, two entities, and then being diligent about following through on, who's responsible for what area, and like keeping the town informed about where we're at with this project, and working with the Main Street community downtown when and if this, well, it's going to happen for water and sewer, but.
I think this is great clarification. Do we need to vote on this?
I mean, you can, but you can wait till next time, I think.
We're also
They-
waiting
No,
for
they-
water and sewer.
They
What's that?
wanted an answer,
We're
don't they?
also waiting for water and sewers
Oh, yeah.
commission, so we're not
right.
ready yet.
So, yeah, we have a little bit of time if you want to look it over some more.
I think water and sewer wanted an answer sooner rather than later.
Okay.
Or it's
They
moving.
haven't decided yet. They have a meeting tomorrow night.
Okay.
But they give you a census of what they'd like to do and a vote.
So
Yeah, but don't they want it? That's the whole reason why we're having this meeting. They want to know.
The consensus of the board at this time is that you approve this memorandum of understanding. Is that correct? If
Yes.
water and sewer makes changes tomorrow night, it doesn't make any sense for you to be voting on it tonight. So it'll be presented to them tomorrow night, and we'll let you know when it's in the box. You could actually have Kathy sign it, barring any changes from water and sewer.
Sounds good.
Sounds good?
everyone says yes. Okay. Hey, Lino. So thank you.
Time is it?
It's 6:15.
Oh,
So it's time to sing happy birthday to Marianne. No, it's
I already got candles for Mike and David. I'm good.
all right. So it's 6:15. We're going to start with a public hearing on the street tree ordinance and the amendments to that ordinance. And I'm calling the hearing open at 6:15. And Catherine, we welcome all present for this public hearings on the street tree ordinance previously adopted in April of 1989 for the town of Plymouth, and Kathy Lowe will speak on behalf of the amendments.
So the street tree ordinance has been in effect for a number of years now. However, recently we did have a property owner in Plymouth. I can't remember what road they're on, but our highway manager went up there. There was some trees that were posing a hazard to the roadway, and they were on their property. So there was a discussion that the property owners would take the trees down and that they would be responsible for the payment. But then when we looked into the RSAs, we realized that when the town declares trees a hazard to the road, the town's responsible. So the town takes care of taking the trees down and takes care of the cost of it. And when I looked at the ordinance was in conflict with the RSAs. So I had our attorney, go through and just make the corrections, the changes to it so that we are in compliance now. We now agree with what the RSA states. And that's that if the property owner, if there's a tree that's declared a hazard on someone's property, it's the town's responsibility to issue them a notification that we declare it a hazard and we are going to go in, we are going to remove it, and we incur the expense of it. The property owner does not. So I'm just looking for the board to approve the amendments, the changes to this ordinance.
Okay. Now, does the board have any comments before we allow the public to comment? Or?
Nope.
Okay. All right. So we're opening this up to take public comment. And we're inviting the public to comment on the tree ordinance. The general rule is that, am I locked up? I guess you can still hear me.
I can hear you.
You have to state your name, the town you're from, if not from Plymouth, and Plymouth as well. And you'll have 3 minutes to address the board with your comment. And unfortunately, now we've got people maybe putting their question in the chat and
Not the question, Bill, just their name.
okay, well, we already have some questions in the chat.
Doesn't show up here.
Why don't we see it?
We're not seeing any questions here, Bill. Just
Yeah,
The only-
I can see them in the chat.
the only person that's asked to speak so far is Karen McLeod.
I see a bunch of chat. Well, I see 2 chat messages. The rest of them are all ...
Right, but those aren't
My-
questions.
Right. But
My
one of them,
my question or comment is for your next topic to be discussed, not the tree
Okay.
ordinance.
All right.
Thank you.
All right. So, is there any? Is David trying to get attention for the tree ordinance? Okay.
Not unless the tree's wearing a mask.
Ooh.
I've seen a few.
Hey, just a quick little thing. Chris Sanborn wanted to speak. He's put it in the chat.
Right.
All right, thank you.
I just want to speak in regards to the mask ordinance later.
Okay.
Hey, Bill, it's
Yeah.
Free Scott. I'll say something.
Go for it, Patrice. Patrice Scott from Plymouth. Take it.
I wish I knew about the ordinance. We just had to pay to remove trees on our property line, and
Patrice,
called the-
Patrice. Is she
Oh.
talking about the mask ordinance?
Trees.
Oh,
No, she's talking about the trees.
yeah. I
So-
should have called the town and had you declare them dangerous. No, I don't have a problem
Now you
with,
know for future.
Only on the street side, Patrice.
right, if it hangs over public property, I think it's appropriate for the town to pay, but otherwise, if it's on private property, it really is the property owner's responsibility. So that's how I see it.
Yeah, when I went to train for, select board, I gotta admit, it was some time ago, but, the town, accepts liability for trees. Trees are a big thing with,
Right.
so,
Okay, well, I think it's good. If it's in a roadway or it's dangerous in any way that could affect the public, I think it's appropriate then.
all right.
So-
Very good. Thank you. You came in under the 3 minutes. Very good. Thank you. Any other comments on the ordinance, the tree ordinance? Okay,
I make a motion, we accept the tree ordinance, the updates.
okay.
Second.
All right, geez. Okay, Mary Ann moves, Neil seconds. Zach, your vote. Oh, any discussion? Seeing none. Zach,
Were we supposed to close the hearing before we voted on accepting the amendments?
Yeah.
Yes.
what do you mean?
Closed you.
I think we have to vote to close the hearing and then we can vote on accepting the amendment.
The chair
correct.
closes the hearing.
The chair closes it.
There's a move to close the public hearing.
The chair actually closes
you,
the
Bill.
public hearing.
All right, I close the
Got
public
all
hearing.
the power.
Perfect.
All
Now
right,
we have Mary Ann and Neil.
So I make a motion to accept the ordinance with changes.
okay.
Second.
All right. So Mary Ann, moves, Neil seconds. Any discussion? Seeing none. Zach, your vote. Okay, Mary Ann,
Aye.
Neil,
Aye.
John,
Aye.
Bill, aye. Ayes have it.
What about Zach?
Yeah, what about him?
I was first.
Oh,
I can vote again though.
We only have 4.
Okay,
Bill, can you see the chat for the list of names, or do you want me to call them out? You can see them, okay.
and so therefore, it is 6:23. I'm opening the public hearing on the proposed mask ordinance. And the Plymouth Selectboard welcomes all present for this public hearing on a proposed mask ordinance for the town of Plymouth. So board discussion, acknowledgement of emails and correspondence received from concerned citizens, both for and against. We'll be depicting that as well. And now I'm opening it up for public comment.
With 3-minute time limits.
Yeah, there will be 3-minute time limits for comments.
And your name and town. Thanks, Bill.
All right. Now the first one was from essentially Chris Sanborn, I guess, right?
It was Karen McLeod.
Is she? Where
She
is
was
she?
first,
Okay.
way up to the top.
Yep, got it. All right. So Karen, do you want to speak to the ordinance? And please introduce yourself, unmute yourself.
Can you hear me?
Yes.
Yes. My name is Karen McLeod. I'm a resident of Plymouth I have been for 41 years. I teach at the elementary school, entering my 31st year this year. I'm also co-president of the Plymouth Education Association, and our negotiators have been working closely with administration with regard to the opening of the building next month. And both parties, the administration and the association, we want the children, the staff, all employees, faculty to mask up. And I was delighted when I heard that there was an ordinance that was going to be presented tonight. And I learned about it last week. And I just assumed it would be an ordinance targeted towards those above 2 years old. And for us, as far as requiring everyone who enters our building, the school, to mask up means 500 plus citizens. That's teachers, faculty members, staff, students. And we want everybody wearing masks and social distancing. And the maintenance, we have been told, they are going to do a robust cleaning daily. Of course, we don't expect the children to be wearing the masks 24/7. We will be educated and guided on providing mask breaks for everyone. The maintenance and administration have combed through the building, and they're working to setting up every classroom, every space, so that we could be 5 to 6 feet apart, which is terrific. I applaud their efforts. But as far as being in the classroom, students will be wearing masks, yet we can choose to have children take mask breaks frequently as they need to when they will be seated at their desks a lot. But I just would encourage you to.
Ooh, that was a cool. All right,
Next person is Chris Sanborn.
Oof.
sorry, Karen.
Mr. Chair, could you direct people to watch the table here? You notice in the corner, there's the red and orange. Orange is you're running out of time, red is you're done.
Oh, can't see
So
that.
going forward.
All right, so, hey, so Ann, you're going to announce the next person?
It's
think
Chris
you did. Am I good to go?
Sanborn.
Yep.
Thank you. I just wanted to address the board. Chris Sanborn up from Plymouth. I've lived in Plymouth for 23 years now. I'm just trying to find out, how can you consider this mask ordinance at this point in time? At the end of, in May, we were worried about a spike coming. At the end of June, the cases in the state of New Hampshire were over 1,000. Today, the cases in New Hampshire are 407. Clearly, the data is showing us that the cases of COVID in the state are declining. In Plymouth area. Plymouth area listed by the New Hampshire state.gov is 1 to 4 cases. All the surrounding towns is 1 case in Campton. You can track that because there was no cases and they just posted 1. No other towns in that surrounding area have a single case of COVID, not 1 case. I'm just not sure how we can even consider this ordinance. I heard you talk about in the beginning about talking about Nashua. Nashua is a city with over 50 cases. I'm not sure what Nashua has to do with Plymouth. I don't think we should be basing that on Plymouth. It doesn't seem to make any sense. If we look at the data and the trend of the data declining without a mask ordinance, why would we even be considering this in July? We didn't need it in May. Now, I know the point that people are going to bring up about the college coming back to town, and I understand their point on that, but if we look at what's happened in the past, and when Memorial Day came and all these people came up from other states, we said a big spike was going to come. That spike didn't happen. On the 4th of July, when all these people came up on vacation from all these other towns, that spike didn't happen. When the protests happened downtown and we said, oh, that's going to cause a spike, the spike did not happen. Just last week, we had maybe 1,000 kids in town over a week for this lacrosse tournament. Spike didn't happen. And we keep saying that this could happen, but we have case after case after case of the spike not happening. So why are we considering, I just don't get why we're considering a mask ordinance at this time. It doesn't make any sense. And then on top of it, people have been, how are you going to enforce this mask ordinance in this town? We live in Plymouth. I pay $10,000 a year in taxes to live in this town. And now you want to enforce a mask ordinance on businesses and myself? It's hard enough keeping businesses in this town and we're going to push them out? I don't get what we're trying to do here. It doesn't make any sense. If we had a spike coming, we have the data at hand that shows us that the numbers of COVID cases are decreasing daily. We went from 1,000 at the end of June down to 400 with no mask ordinance. That's enough shows us why are we even considering this? It doesn't make any sense at this time. I heard you talk about Nashua. I just don't get why we're trying to compare to Nashua. This doesn't make any sense. Thank you.
Chris.
Homer Ahern Jr.
I probably ought to defer because I'm not a resident. I am a taxpayer, but I want to defer to the other residents, and hopefully you'll let me speak at the end. Thank you.
Thank you. Judy DeLeo.
I just actually want to make a couple of statements. We have a lot of elderly in the town. As far as those lacrosse kids, I saw them all running around wearing masks. So that was awesome that those lacrosse kids and parents were wearing masks walking to and from Holderness School. I also want to mention that Plymouth State has mandated, and I'm sure Marlon will be speaking to this as well, but Plymouth State has mandated that all students wear masks on campus, in campus buildings, during classes, moving between classes, and they're trying to keep them, the professors safe, the students safe, and any other people that they interact with safe. I think that having the students go downtown without masks is irresponsible because we want to keep the townspeople safe. We want to keep the people and businesses safe as those same students that are required to wear masks on campus, have them wear masks off campus. And that's it.
Okay, thanks, Judy.
Magnus S.
Hi, my name is Magnus. I have lived in the town of Plymouth going on 2 years now. I originally came here as a student and I live and work here. And my concern as somebody who actively works here in Plymouth is that we have people who actively come here and do not care to put on a mask when asked politely to please wear a mask for the safety of not only themselves, but the safety of others, because this could get worse in wintertime. This has been a statistic from the beginning that come in the wintertime, cases will spike and things will get worse. So my concern as somebody who has been an employee who has had to work through this whole entire pandemic is that I want to stay safe and I want my coworkers to be safe and I want everybody who comes and shops and lives here and all of those things to be safe and to mask up and to social distance for 6 weeks. This disease would be gone. We would be done. We would be out of the ballpark if we would all just listen, mask up, and social distance. That's literally all we have to do. But the fact that I constantly encounter people who are rude, who are angry about having to wear a mask for an hour when I wear a mask for 8 to 9 hours a day and I can breathe, I can function, and I have not passed out, and I am protecting not only myself, but I am protecting elderly individuals who live here, who there is an abundance of. And I care deeply about the people that I am going out every single day to do work for. I care deeply about the people around me. That's why I wear a mask out in public, even though there's no ordinance. So having an ordinance would allow, you know, everyone to stay safe, no matter how big or small your town is. That's why we're looking at the national ordinance, is it's an example. We can modify an example to fit our town. And we're a college town, so just as someone said before, you know, it would be better for us to mask up, especially with a lot of students in the public. Thank you.
Thank you, Magnus.
Quentin Blaine. Quentin, you have to unmute yourself.
Down in the left corner at the bottom.
Actually, it's
This one. Okay, gotcha.
There you go. Oh,
you're muted
you muted it again, so hit it again.
How are we doing?
Perfect.
As somebody told me on another Zoom meeting, I need a 3-year-old around to help me out with these. I'm speaking first. My name's Quentin Blaine. I'm a resident of Plymouth. I'm speaking first as a trustee of the town library, Peace Public Library. The trustees of the library recently voted to require a mask to enter the library as we are reopening it to the public again. And the trustees did it because we think that it's, we want to really make sure we protect our staff. I was very happy to see that the town ordinance said government buildings on it, because I think the library is a building that's owned by the government in the town of Plymouth. And we're, of course, concerned about enforcement. We have librarians to enforce it for us, and they're concerned about it. But they're willing to try, and they definitely want to have people masked up as they come into the library. They want to get going on that. They've been in there already making books available, getting the circulation going, and they try as hard as they can, and they want to open up everything else inside the library for people to browse, for people to use computers. But they don't want to do it and where the trustees don't want it done at any great risk to them. So this ordinance would back up what we're trying to do at Pease Public Library as well. And I think it makes sense. A lot of, when I hear negative things about masks, they're not very onerous to me. I try to wear one around. I would like to make sure that the ordinance separates those out on a recreational walk or something, and just downtown, because to go for an exercise walk and wear one, as long as you recognize you're 6 feet away from people, I think ought to be allowed. And that's for me personally, not from anything with the library, of course. But I think they work. I don't think it's the time to say, okay, let's pretend this is all over and we won't get any virus. It's, we should have learned more in the past 5 months about this sneaky little virus that's around a lot. And, we should be aware it's out there. It can come in. It doesn't have a look of any one person or anything else. It could be a child. It could be an elderly person. It could be anyone. And until we have a vaccine, I think we have to be careful of what we do. And now it's just far too early. Thank you. Wrapped up.
Next name is Joanne.
Yes, Joanne Magnan. I've been a resident of Plymouth for 36 years. I want to voice my support for this mask ordinance. We see that the pandemic is not waning nationally. Soon we're going to be welcoming back the Plymouth State College students. They come, many of them from out of town, from out of state, and the population suddenly is going to increase dramatically. We're going to be a little closer together and a little more congested. It just makes good sense to wear a mask. It's an easy thing to require, to ask people to do, to put a mask on. And I think the rewards for safety will be tremendous. So that's really I just want to voice support for the mask ordinance. Thank you.
Under David and Micah, they both wanted to speak. David, you're first.
Hi, my name is David LaRue. You guys probably know how I feel about the mask ordinance, so I'll tell you why. I echo.
David, where are you from?
Oh, I am a Campton resident, and my is a full-time student at the college, and as such, we are required to be in Plymouth as part of the general community. So I would echo what Chris Sanborn has said. We've seen lots of times where people have come and gone. We have not seen corresponding spikes. Also during lockdown and since coming out of lockdown, we have not seen any appreciable slowdown in out-of-state traffic. Now, as per the New Hampshire state level, the governor has not mandated that anybody coming from Maine, New Hampshire, Vermont, Rhode Island, Connecticut, or Massachusetts, any of our neighboring sister states, they do not have to quarantine. They're not asked to quarantine anymore, okay? Now, so if we talk about the college, because that is really where this push is coming from, because we're talking about influx of people. With the college, I feel like a lot of you probably have not taken the time to go see what the college's policies are. I have them out in front of me. Any student, so we'd be talking about as far as level, people who are not from New England, they would be required to quarantine. They are requested to quarantine from the state level. Now, Plymouth State University, their standards are much higher. So if you say we might have 5,000 students coming, maybe 2,500 of them come from all over the world. A lot of them are probably from New England. So maybe we're talking about 2,500 students. Per the policy, the students must sign an informed consent agreement, which says pre-arrival testing. All students, faculty, and staff who intend to live, work on campus, conduct work at research sites will be required to show proof of a negative COVID test before coming back to the college. When they move in, they are only allowed to have 2 people help them. There are staggered move-ins. People assisting them to move in will be required to answer screening questions. All of this information is out there. The college has nailed this. There are so many requirements. I don't have time to read everything, but if you go through the opening plan, it is all there. In under an hour, you can see everything about what the college is asking. Students are subjected to routine COVID testing. The college states that they expressly have quarantine housing set up for students who test positive. Students who are in more high-risk environments, such as sports or other organizations, are required to be tested more often. And to the point of being downtown, the safety rules direct from the college read, wear a face mask in all academic buildings, indoor public, this is the last thing, indoor public campus spaces, and downtown Plymouth when social distancing is not possible. So the concern about students downtown, the college has already covered that.
Are you all set?
Yeah, thank you. That was my 3.
Thank you.
Whenever you're ready for Micah.
Micah, you're next.
My name is Micah. I own Micah's Property Maintenance out in Plymouth. I have been a resident of Plymouth for on and off 14 years. I went to Plymouth Regional High School, all this sort of thing. Here is my concern as a business owner that, well, a property maintenance company, I work outside. I'm a landscape company. We build stone walls. We do tree work. We do all this sort of thing. We mow. Now today at one of my commercial places that we do, which is in Plymouth, I decided to do a little mask test. So I got a package of those reusable masks that disposable masks that everyone has been using. And I put it on my face and I grabbed a weed whacker, which is one of the tools that we use. And I went out and I decided to go at the same pace that I usually go. 11 minutes later, I could hardly breathe in this temperature and in this humidity. And so I had to take about 20 minutes to try to catch my breath, stop sweating, all this sort of thing. Within 2 minutes, the mask was completely saturated. Now, working outside is a lot different from being in a school or an office or wherever, which, by the way, anyone talking about the school of the Plymouth Elementary School or whatever, that school we're not a charter school, we're a town. So just letting that happen. So anyways, moving on from that, there are so many things that are just wrong with this ordinance, such as members of the public entering any business, including without limitation. I want to stress on the without limitation, any outdoor area where business of any sort is conducted. So that basically states that my guys need to be wearing a mask at all times. Now, I don't want to send my guys to the hospital. They want to work. All right. They really want to work. They haven't collected during this whole thing. We've been working the whole time. So we would like to continue doing that. Another thing is employees of all businesses shall wear a face covering over their mouth and nose when interacting with the public and whenever they are within 6 feet of a coworker or a customer. So I guess that means I can't really build walls in the sunshine as it is, because my guys just won't be able to breathe. And we will end up in the hospital is kind of where we're going with that. Having to do with the lacrosse kids, were they wearing masks out on the field? Were they social distancing when they were beside each other? Did we have a spike from that? No, we did not. Having to do with number 5, if I have time, hopefully I do, we're wrapping it up. It says permeable material. Well, I don't know if you know what permeable material is, but moisture can go in and out. So that obviously won't work. Now I'm done. Thank you.
Thank you. Thad Defaw, maybe?
Yes, hello, can you hear me?
Yes.
Okay, I'm Thad Defaw. I'm a resident of Plymouth, and I just want to voice my support for the mask ordinance. Just a couple points I want to cover. Not wearing a mask, you don't just endanger yourself, you endanger other people. You know, the science says right now that actually wearing a mask more protects other people than it protects yourself. Also, I don't think we are even over the first wave. There's probably going to be a second wave, which is going to be worse. You know, with all these students coming back, it could be a major health issue. As far as businesses, I've heard a few business owners express concern that they would lose business. I just want to point out that since the pandemic started, there's about half the businesses on Main Street I have not went into. But the reason I have not gone into is because they do not require masks. And so basically, you know, I think there's other people besides me that, you know, businesses are losing my business if they don't require masks, and I don't think I'm the only one. As far as, and I've actually made a point of going to other businesses, even outside of Plymouth, that are more responsible. As far as enforcing, I would say as stiff a penalty as possible, at least the cost of a parking ticket. You know, at the end of the day, it's a sign of respect. I'm assuming that outdoor, you know, especially mostly with indoors, I would think that outdoors, if, you know, if you can maintain 6 feet distance, you know, that's great. I think I'm done. Thank you.
Thank you.
Hello. Can I make a comment?
Not yet.
All right.
What's your name?
My name is Charles Moriel.
We'll call on you shortly.
Okay, thank you.
Yeah, are you a Plymouth resident? Oh, crap. He just muted himself, but.
The next one is Marlon Collingwood.
Hello, my name is Marlon Collingwood. I am the Vice President of Communications, Enrollment, and Student Life at Plymouth State University. Donald Burks, our president, was on. I think Don had to leave for a Board of Trustees.
Oh, there, Marlon.
Oh, great. I'm going to let Don speak first.
Thanks, Marlon. I've been sitting here listening to you, and I appreciate the comments on all sides. And I also appreciate the comments from one of our students about the thoroughness of our plan. If you haven't had a chance to take a look at it, please do. I hope it'll put your mind at ease. But one of the aspects of that plan is really the attempt to try to protect the citizens of the town as much as possible when we have an influx of students, particularly when the students are coming back initially. We're going to run 3 sets of tests, one before they get here, one during the first 2 weeks of class, and then one at the end of those 2 weeks. And then we're going to do 10% testing every week after that. The issue here really is we don't know, we will know pretty much what our student population comes in. We'll have assured as possible, as much as possible, that they are clean of the virus. But there are a lot of unknowns, and we're just concerned about the residents of the town, and we want to be a good neighbor. And so we're supportive of this amendment, particularly because of the fact that we think it sets the tone for our students when they get here to try to be really careful of the people in the town and those around them. We're going to be careful on campus, but the idea was to be as protective as possible of the community that we share with all of you. So Don Burks, resident of Plymouth.
And I will just take 30 seconds. The other thing is and thank you, David, for reading the plan. A lot of the people haven't, so I love the fact that people are doing that. One of the things we've been working with Dr. Benjamin Chan, the state epidemiologist, obviously, and one of the things that he has told us is that for a plan like ours to be successful, it has to have a variety of layers to it, right? So we used a fishnet example. The more layers you have, the less likely a fish is to escape. And we believe that masks on our campus and that masks in town will be an important part of the layers that we're putting in place on our campus, and we're wholly supportive of that. Thank you.
Thank you. Dennis McGlone, or Denise McGlone?
Yes. Hi, Denise. I am a resident of Plymouth. I have lived here for 30 years. I have been in the health education field for 35 years. I currently teach at Plymouth Regional High School. And I'm really hoping our decisions are going to be based on what's best for the health and safety of our community. I did send the board peer-reviewed evidence-based research studies to look at regarding the efficacy of masks. And I know our numbers are low right now, but with NASCAR coming up and Bike Week, and it just, we have all witnessed what has happened throughout the rest of the country, and things can change very quickly. I think we've actually been pretty lucky so far. And then PSU coming in, over 4,000 students, and they are doing wonderful things to keep their students safe and to keep us safe. I just really hope that we make our decisions based on science. It is the best practice. They do work. It is such a simple thing. I really can't even believe we're debating this issue. They're being, you know, it's the World Health Organization, the CDC, the American Medical Association, American Nurses Association, the American Hospital Association. It's a best practice. It is what works to slow the spread of the virus. So thank you for listening.
Thank you. Melik Hammond.
Hello, thank you. My name is Melik Hammond. I'm a resident of Plymouth for the past 7 years, and I wanted to speak, but also I have a question as well and potential suggestion moving forward. As a resident, as a father, and I definitely support the mask ordinance as a general concept. I do have some questions specifically on section 3. It reads, members of the public entering a restaurant for the purpose of picking up food for takeout or any other purposes must wear a face covering over their mouth and nose. Members of the public dining outdoors at a restaurant may remove face covering while seated at their table. I mentioned this specifically. I am in the restaurant and hospitality industry. I do support it in the fact that we have been wearing masks in our businesses this entire time, and it has been a double-edged sword having the patrons not being required to wear those masks. And so having the support and actual direction to have the patrons come in wearing masks would be both safe and beneficial and just appreciated. One loophole, though, that I do see, and I was requesting clarification on that number 3, as it reads, somebody coming in to dine indoors is not mentioned here. And the biggest concern that I have is if this could be understood to say that dining indoors is not allowed, and I hope that is not the case, because that would be extremely detrimental to any businesses in the town, any of the restaurants in the town. But as it reads, it does have ambiguity of indoor dining patrons. So I was hoping there could be some clarification in that. And then lastly, in reference to Micah and David's concerns, I think there is opportunity for some clarification in the verbiage to be empathetic to people working outdoors where they do have some valid concerns as far as social distancing being an opportunity. And thank you very much.
Thank you. Bridget Powers.
I'm just listening. I didn't request to speak.
Okay. Dr. Viking Hedberg.
Hi, Viking Hedberg, resident of Plymouth for 23 years, as a pediatrician in town for 20. And I really appreciate this opportunity to discuss this, and also for representation from the college to present what I think is a very carefully crafted plan. I'm strongly in favor of requiring masks, but I am concerned on number 2, and specifically Micah's concern of trying to work outdoors in heat with a mask is very troubling, and I think a relatively low risk endeavor, not necessarily zero risk. I'm very concerned about one of our teachers and a biology teacher expressing that we're out of the woods with this. This is a virus, if you underestimate it, we will be overwhelmed by it. And I think each state that has opened early and with a sense of we're fine is now seriously paying the price. We don't have the infrastructure to handle that. And although there's many things Mr. Sununu and I may not agree on, I'm very, very grateful for him closing things down to allow us to prepare. I'm currently working at Concord Hospital. We still are not fully prepared. You know, we're reusing masks, and it's an effort of trying to get in. And if we let things blossom, we will be in a very desperate situation. And I think the burden of wearing a mask, I would take the exception of while installing stone walls at 90-degree heat, I think is extremely small burden when we're in particularly enclosed spaces. And I think with some clarification on that, I think it's a very strong statement and well worded. I would appreciate a comment from either Dr. President Burks or Marlon Collingswood about turnaround time for testing. I had a test done last week or 2 weeks ago, and I had a 9-day turnaround, which is essentially worthless because the Quest Labs is overrun. And if the turnaround time is within 24 to 36 hours, that could be a very valuable thing. I'm just wondering what that availability will be, particularly when all colleges and schools are opening up at this current time. So I'd yield the remainder of my time to comment from the PSU leadership.
Thanks. Just a quick answer. We've got a special arrangement with Quest. We're also building an internal capability. So we've got a guarantee of 48 to 72 hours, and they're leaning towards the 48 hours. So, and that's part of the reason we're running 3 sets of tests. The test of the students will occur before they get here. So we'll have time to do that. Then to verify it, we're going to have a test when they get here, and then one after. They won't even be on campus if they've tested positive before they get here, and we can have a 5-day period to do that. You're muted.
Would you be able to share, once that initial experience of testing occurs, that is stayed within that 36 or 48-hour expectation?
Sure. Marlon, do you want to add anything about that?
Just add that part of what we did, and it's a joint contract with Keene State College and Plymouth State that we've been negotiating for about 2 months with Quest Labs. So we have actually purchased lab space, reserved lab space for the next 6 weeks at 2 of their labs in the Massachusetts area. So the only way we would have gone into this contract, and there are deep financial penalties for them if they don't return the tests in the time that they have outlined for us. And then the other thing I will say is our results go to the person that was tested, to Plymouth State University, and to the state of New Hampshire. So all of our testing will be reported through the state. We're actually planning on putting out daily test results on our website as well. So we're going to be as transparent as we can about how the testing is being done, how long it is taking, and and how many, what percentage of people are testing positive or not.
Excellent. I think that partnership and that transparency is incredibly valuable. Thank you.
Thank you.
Thank you. Kevin Kushan. Probably murdered that.
Hi there.
This is Laurel Seashon, actually. It just comes up with his name. I've been a resident of Plymouth for 6 years now. I have kids in the school district here. I first want to start, I've been doing a lot of research on this particular issue. I happen to be one, and I want to remind everyone that everyone handles masks differently. I am one who has a very, very hard time. I won't go private, but it is very that required. I want to start with a quote from the New England Journal of Medicine, and it goes, "We know that wearing a mask outside of healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes, and some say more than 10 minutes or even 30 minutes. The chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic." It further goes on to say, "We are all subject to fear and anxiety, especially during times of crisis. One might argue that fear and anxiety are better countered with data and education than with a marginally beneficial mask, particularly in light of a worldwide mask shortage." That being said, that's the end of the quote. I did want to ask a couple questions for consideration. One, I'm not sure really what science and data then backs up this mandatory mask proposal. You know, someone talked a little bit earlier about the rates in Plymouth, and we talked about all the wonderful testing that Plymouth University is doing. My daughter's actually going there this year as a freshman, so I know exactly what they're doing there, and it is quite intense and a little daunting for a first-year student, I'll add that, but she's going to do it. I just want to say, you know, for people like me, who it's very hard to wear a mask, and from other people who work in these settings, I want to know what the data is and the science that you all are talking about, because I am not finding it. Putting a scarf over my face is not going to protect the person next to me. It's not. Or it's minimal, I should say, it's minimal. And most of the stores and restaurants in Plymouth already require face covering, so I'm not exactly even sure what this seemingly heavy-fisted, open-ended mandate is going to do for us and accomplish. And I wanted to know, also point out that how, you know, we also need to consider the negative side effects of mask wearing. We heard the head of the anesthesiologist at LRHC speak on Sunday. I see it's time. I can't believe we only have 3 minutes, but there's a lot of negative side impacts.
We are looking for David Nash.
Hey, good evening. My name is David Nash of Plymouth. And just for the record, I can sort of identify everybody that's in the Plymouth Town Hall, but I'm not sure if the other folks know who's there or need to know. And so I'm going to comment a few things, and I may misquote some things or what have you, but I want to concur with the last speaker about the masks. And I think the real issue here, though, that we're missing is the legality of this. And the viewers need to know that the Nashua ordinance is not set in stone. There's been a legal challenge to that. And I think the residents of Plymouth need to know that should the Board of Supervisors pass this, there'll be a legal challenge to it also in the town, costing the taxpayers a lot of money. You know, this lends itself to government overreach. Will you now decide or find something in the ordinance that says my Second Amendment rights are a threat to the community, and now we're going to take your gun, or we're going to check your house and make sure, you know, you've scrubbed all your surfaces clean? to the other comments of you can't go into a supermarket or the library or anywhere else and be protected because somebody before you just picked up that can of soup and set it down and now you're going to grab it and take it home, or that library book. The other thing I was, having been chimed in or been at the work session, I was surprised to hear Mr. Terrell say that the board, really hasn't even discussed this ordinance up until now, and how is this happening? You know, this ordinance coming to alarm the community without any public notice or discussion or time to comment. Chris Sanborn's point that we have virtually no cases in the town should be enough to thwart this ordinance. But again, my point is that we really are pushing a legal limit here that I don't think the town needs to go down. If a business wants to require me to wear a mask, that's up to them. If the library, if the government offices want to require me to wear a mask, fine. But the mandate that...
Sorry, David, I had to shut you off. Patrice Scott. And before you start, Patrice, there's a lot of comments that are coming into the chat. If you want to speak again, or if you have a question, please put your name in the chat and we will call on you. If you have not spoken, we'll put you on one list. And if you've already spoken, we'll put you on the second list to speak again.
Right.
Thank you. Patrice, you're up.
Okay, thank you. I won't take long. I do have a question, and I would just like to say for the record, I wear a mask. I believe in wearing masks. I just have a problem with mandating wearing masks. I really don't think it's necessary. I think the people in Plymouth are all very considerate, and we've been wearing it, but I would leave that up to the medical professionals. I have great respect for Dr. Hedberg and his wife Kate, the nurses I know. If they feel it's required and must be mandated, you know, I'm open to discussion. The ordinance itself, I think, is overbroad, and I have problems with it because it doesn't have any kind of enforcement mechanism. I absolutely don't think the college kids are going to be following any mandate. But beside all of that, I was just wondering if we could hear from our public health officer, and does he have any reason for supporting this ordinance at this time? And you know, I'm petrified about the college kids coming back. I have relatives in New York and New Jersey, and I've seen how that's gone. I've also seen children at the age of 6 trying to keep a mask on, and I don't know that that's going to go very well. But you know, I feel it should be a voluntary thing, and I think most people are in our town are going to abide by it. So that's all I want to say, and ask if we could hear from our public health officer if he has any findings that supported this, or is this something that just came down that, you know, everybody wants to jump on the bandwagon?
Bill, before we go any further, I noticed that Gigi asked to speak, and she is a Plymouth resident.
She is on the list, Neil.
Okay.
She is. I have quite the list going. Sorry. Tom? Tom, you're still muted.
Just locked up. It's
There you go.
Thank you. Hi, everyone. Thank you for your input. I certainly am a believer in the benefits of face covering. As we discussed at the last couple of meetings, I'm happy with the efforts that we've been putting forth to do this voluntarily. We have written letters to the editor. I know some of the board members have spoken to the press. We've produced messaging about the value of face coverings. I know I think the town manager has spoken to the Grocers Association. We've made some progress there, as well as multiple businesses in town who we all know have been enforcing this on their own. We've also joined the Department of Health and Human Services Don't Go Viral messaging campaign, which encourages mask wearing, particularly in what they consider a vulnerable population to come, if you will, age 20 to 30. And I think this is
Tom, you muted again.
Sorry about that. I think that we've made some progress with that, with making it voluntary versus compulsory at this point. I'm not sure if we're going to gain a lot by making it compulsory. I'm certainly open to hearing all sides. I think we have some discretionary time. I know the board's not going to vote on this tonight, so that's all I have for now. Thank you.
Thank you. Phil Lamoureux, you're on. Tristan McLean, you're on deck.
Thank you. I'd like to voice my support for the mask ordinance. I am a resident of Plymouth. I've been here for a few years. I think that we can only understand our local infection rates in hindsight, and I don't think that it's worth risking the potential for an infection in our community. Given the fact that we do have a lot of unknowns coming up. A few people had mentioned that there were several hundred kids in town recently for a lacrosse tournament. I don't think we would see a result of that yet, even if that were to have been a source of local infections. Other people have mentioned Bike Week, NASCAR. With students coming back, there will not only be students, but I believe, it's pretty typical for parents to come help kids move into town. And, even if parents are only in town for a weekend, if they're coming from areas with potential infections, I really don't think it's worth the potential of risking an infection in our community. The inconvenience of wearing a mask is relatively small. And as they say, an ounce of prevention is worth a pound of cure. We really don't know what the long-term effects of coronavirus are. That we're getting a handle on the mortality rates, but I don't think we really understand the long-term effects of people who are still struggling with it, with 2 to 3 month infections. So I thank you for your time, and I trust the judgment of the selectmen, select board here. Thank you.
Tristan McLean. Next up is Sarah Tyrell.
Hello, I just want to voice my opinion. I am in favor of the ordinance.
Tristan, where are you from?
I am currently in Hebron, but I am a resident of Plymouth. I'm moving back into town in 3 weeks. I did go to PRHS, and my father has been a local business owner up until about 2014, I believe. So on that note, I do work outdoors. I do landscaping. I do a lot of lifting. I am present in the common, regularly walking in 90-degree weather all day long, sweating. And I'm wearing that mask the whole time, and it does not affect me whatsoever. I do believe we should follow science. I moved back to New Hampshire 3 weeks into the virus, at approximately the first week of April, quarantine, and came up here for my safety. And the last thing I want to see is an outbreak happen here when I came here for sanctuary. And that is all I have to add to the conversation.
Thank you. Sarah Tyrell, you're asked to speak. And Charles Morrell, I believe you're next.
I don't think I asked to speak, but I will say I'm in favor of the ordinance as a local.
There was several comments on the chat.
Okay. I'm a local Plymouth resident. I'm also a parent of a PES and a PRHS student, and I support the ordinance. Thank you.
Charles Morrell. Teresa.
Yes, I don't live in Plymouth. I reside in Waterville Valley, but I shop in Plymouth quite frequently, and I am 100% against the proposed face mask ordinance for the town of Plymouth. There are numerous videos that show how these face coverings reduce oxygen intake to unsafe levels when being worn. People are also, breathing back in their own carbon dioxide while wearing these face coverings. And I believe we as humans were never meant to wear face masks during regular, everyday civilian activities like shopping. Just a year ago, this would have been unthinkable. And there are videos of even Dr. Anthony Fauci clearly stating 3 months ago that regular people should not be wearing face coverings. He states that when people adjust the mask, there's a greater chance of, possibly spreading, any type of virus. And furthermore, I cannot stand the feeling of wearing a face mask. I had to wear a mask at a barber in Plymouth, and within 10 seconds of me putting it on, I feel that claustrophobic feeling of being suffocated. And many people I've talked with share my view about this as well. So I'm totally against it, and I think the only right decision would be to totally deny any ordinance requiring the face mask. And I believe it also strongly violates our, constitutional rights as people and human rights. So I am 100% couldn't be more against it. Thank you.
Thank you. Teresa Aguirre, you're up. Jay Robinson, you're on next. Teresa Aguirre. Jay Robinson. Robertson, I'm sorry.
That's fine. I'll answer anything. Ask Mr. Bolton.
Thank you.
Yesterday. I greatly enjoyed our conversation yesterday. I thank everybody in the community of Plymouth for giving me an opportunity to speak. As Mr. David indicated earlier, there does appear to be a predisposed decision that has already been made regarding this mask mandate for the citizens of Plymouth. That is completely regrettable. I'm going to ask that you listen to what I have to say with an open mind. We all gather information from our preferred sources. And as we go through our academia, we know that we are required to obtain reliable, credible sources. When we gather our information, it is absolutely imperative that you not only check what you hear, but you recheck and you recheck what you hear. Just this morning, I was listening to a local Boston station say that there was a spike of cases in Texas. I immediately went to the Texas DHS, and there has actually been a decrease of 600 cases over the last 3 days. They are on the decline. We are in the midst of an information war. Our mainstream media is giving us what we want to hear when we subscribe and sit and listen to what they're telling us. I implore upon you, research your information and then check that information. Dr. Fauci has bounced all over the spectrum. I respect his education, but just this morning, and this is what I want you to take a look at. Why is the fear being created? Why is ineffective testing so heavily marketed and campaigned? Why are masks, which unhealthily disrupt the natural biological respiratory process, and ineffective, it's been proven ineffective, is being mandated? Why now? Just today, we had a large group of doctors testifying before the Supreme Court of the United States that there is a mass amount of misinformation about this virus being disseminated to the general public to create fear. This is driving this entire virus. It is a 99.98% survival rate. Dr. Emmanuel from Nigeria testified today that she has treated over 350 patients, one of them a 92-year-old woman, an 87-year-old man, successfully with hydrochloroquine, zinc, and something I can't pronounce, samycin. She has treated 350 patients with 0 deaths. There have been no transmission cases recorded globally, worldwide, since the inception of this virus. None. 0 from student to teacher, teacher to student. This is what I'm going to ask you. If you want to pass this ordinance, you're going to deal with the HIPAA violations, requesting papers that people show.
We'll put you back on next time around. Gisela Estes, you're on. Bill Carroll, you're on deck.
Hi, I'm Gisela Estes. I have lived in Plymouth for 49 years. I taught, my career was teaching at the university, and I am in favor of all of us wearing masks, of the mask ordinance. And somebody said we haven't had a spike in spite of having groups coming in. I don't want to see a spike coming, and the best way to prevent it is for us to wear masks. And furthermore, I'm one of the elderly people in town, although I don't like to admit it to myself, but I'm also a caretaker for my husband. And I think we are very vulnerable, and especially my husband, and we are very careful. We are wearing masks when we are outside, when we are going downtown or any store, and I would like to see the ordinance pass. Thank you very much.
Bill Carroll. Julia Bernier, you're on deck. Julia Bernier, you're up. Omer Ahern, you're next.
Thank you. Sorry, I had trouble finding my unmute button. I'd like to speak in support of this ordinance. As I said in my comments to all the people that are saying that this is not needed, our case numbers are down in the state of New Hampshire, we should not wait. We know how long it takes from the time that there is somebody that tests positive. It takes weeks before you see an uptick. And at that point, it will be too late. You can't then say, oh, well, sorry, we need to wear masks. It will be too late. Have we not learned anything by watching what is happening across this country? We know we are about to have 4,000 students come to our little town where we have a little hospital. And these students are coming from all over the world, all over the country and all over the world. And they are 18 to 22-year-olds. They are going to be 18 to 22-year-olds. And as others have said, I think it's very important that we set the tone in the town. We want the students not only to wear masks on campus, we need them to wear them when they go into stores and restaurants. I've also heard people say, if you want to protect yourself, wear a mask. Don't make me wear a mask. We've seen the research. Yes, a mask will protect me if I wear a mask somewhat, but mostly my wearing a mask protects you. And when I'm out in public and I'm wearing a mask and I have people crowded around me, all around me, not wearing a mask, I think that is unfair. It is unfair for people to make a decision about something that will impact my health. And I appreciate the select board taking up this issue, and I strongly support this ordinance.
Thank you. Omer Ahern,
Can you folks hear me?
we can.
Thank you very much, and thank you to the select board for letting me speak. I am a taxpayer in the town of Plymouth. I live presently in Wentworth, and I just want to share some things. I think the mask ordinance is a bad idea. In my mind, it violates Articles 8, 10, 14, and 38 of the New Hampshire Constitution. As my understanding that the Nashua court case is not yet over. I believe that there is a need for an actual formal, written, professional medical reports from reputable organizations validating the underlying basis for the purpose of this proposed mask ordinance, and publicly make that written professional medical report available to the public for a public hearing, formal public hearing before the Board of Selectmen, before a formal vote of the Board of Selectmen is taken. And at this point, I think the town of Plymouth should be doing more to support its law enforcement folks in preparation for some things that some of us see coming down the pike. And my last comment is, fear destroys freedom. Thank you very much.
Thank you. Lorna, you're up. Mike's son, you're next. Lenore? No, you're all set. Okay. Mike's son.
Hi, thanks to the board. My name is Mike Sun, Plymouth resident, 9 years now. I teach microbiology at the college. So I'm actually in favor of this ordinance. I think the mask wearing benefits all of us in terms of mitigating the spread of not just COVID-19, but of all other airborne pathogens that are going to fly out of our mouths with our respiratory droplets. I do sympathize for people like Micah and others that work outside in this kind of heat. And I think the mask, if you're socially distancing, like I'm sure Micah and his crew are, then I don't think, you can't expect people like that to wear a mask and work in those kinds of conditions. And I respect that. However, for the rest of us, I think the more we do to help ease the spread or prevent the spread of any kind of infectious diseases is, I think, it's just civility. And I think we need to all just respect one another for that. I just think the university as well is doing everything they can. The plans that they have in place are for the benefit of the PSU student community, the faculty, staff, as well as the community at large. What we need to consider is that care who you are, where you live, what your ethnicity is. They don't care who you are. They will go if you are there. And so, yeah, we're 1 to 4 cases in Plymouth. Consider us lucky. But the question is, I'd rather be proactive than reactive, because if we are being reactive, that means, people are going to be dying, worst case scenario, or hospitalized, which is also not very good, right? So I'm in strong favor of this ordinance. Thanks.
Thank you. Denise McClone? No. So
No.
has everyone gotten to speak at least once that wanted to speak? Steve Rand?
I have not gotten to speak.
All right, hold on just a minute. All right, so we'll start with Steve Rand. That was the first.
I got the hand up first, George.
You beat me.
So of course, like you all may know that masks have been part of my life for the last 2 months. I've been out distributing free masks all over the state of New Hampshire, working with Rotary clubs and the Common Man. And I obviously think that masks are important. And then the question becomes, how are we really destroying people's freedom of choice and their constitutional rights when we ask them to wear a mask? And frankly, I don't think so. I think this is like the primary example in my mind is people coming into retail stores. Of course, that's you can understand my point of view. And so it's sort of like asking people to wear shoes when they come into the store. We don't seem to have a problem with that. We do. So when we ask people to take certain precautions, mostly for their own benefit. In this case, it's for the benefit of people around them. So the thing that's really important to remember is about the COVID is that it is most transmittable before we know that we have it. So in the period of time between when we actually come down with the disease and when we actually know it, which is 3 to 5 to 7 days, we are most able. That's the highest level of our ability to transmit that disease. That means that every one of us walking around that we don't know we have it are also in the position to transmit it, regardless of whether we have it or not. So the question is, do we exercise reasonable caution to keep others from receiving a virus that would be unnecessary if we wore a mask? I think we should wear a mask. Thanks for the good discussion. There was a lot of excellent discussion on the common yesterday. There are situations where the show must go on. I think there are accommodations can be made, and I suspect there are some changes in the ordinance that could accommodate situations like Micah's and maybe some of my guys, frankly, who are out there working on machines in the field, repairing them for rental customers. There could be work done on that. Thank you very much.
Thank you. Next is George Kirk, and Steph Halter is on deck. George, you're up.
Good evening. George Kirk here. I am not a Plymouth resident. I am, however, a property owner. I own 4 commercial properties in the town of Plymouth that I do retail business with. I am also running for state rep for the town of Plymouth, Holderness, and Hebron. I am against the mask rule. However, I am not against masks. I have a lot of customers and some who I've heard here this evening who feel more comfortable wearing a mask. I don't have any issue with that. I wear a mask on occasion. I'm not, again, I won't say I'm against them, but I am against being told that I have to wear it all the time. I am definitely concerned for my police department and my fire departments. I mean, especially the police that have to deal with this. They already have too much work to do as it is and not enough help, as do we. We work on accident scenes with police, fire, sometimes coroners. Unfortunately, there are teams of people there that help clean up accidents and do things. You know, a few weeks ago, we did a tractor trailer where unfortunately a gentleman lost his life. We tried to get in there and do that as quickly as we could. You know, the people that were doing that job, it was 90+ degrees out. We were not masked. We could not get enough water. I just could not see that I could have performed that horrible task wearing a mask. It just would not have, I would have passed out. As it was, I almost passed out as it is. And so my helpers had to keep taking breaks as well as the firemen. So to say that everybody needs to wear a mask all the time, it's just unreasonable. I respect the people that want to wear a mask. I have masks in my business. If I make someone uncomfortable, I have no issue with putting a mask on. But I don't need a rule to tell me that I have to do that. And I don't think anybody needs to. We're adults. We're pretty smart. And, you know, I have a box right here I went and got, and I bought 4 brands of masks. Every single brand says it's not for this. It will not work. Right on the box of masks. So you're asking me or telling me that I should use a product that tells me right on it that it doesn't work. You know, I don't think it's right. And again, I don't want to make anybody uncomfortable. I have no issue with masks. You know, my gas station, we're a full service gas station. My customers never need to get out of their car. My people will pump the gas for them. They don't know how to wear a mask. They're in and out. They have to talk to people. That's all I'm going to say. Thank you.
Thank you. Steph Halter, and the Whitmore family is next. Steph, you're up. You have to unmute your line, Steph.
There we
There you go.
Got it. Just finding the button. Sorry about that. So I wrote a letter in support of the mask ordinance to the town. Did you guys get my letter by chance?
Yes, yep, they've been passed on.
Okay, great. So as long as the board received my letter, I don't feel the need to say much more other than I would support it going for younger children. You know, I was a little bit surprised that the ordinance didn't voice wasn't going to support it for kids that are school age, you know, 5 and up. I think 3 and 4 could probably handle it. Would it be problematic for parents for sure? But 5 and older, I think I feel pretty comfortable with parents being able to work with their kids to get them to wear those masks. And just as being a responsible parent, I think I've already been doing that. And I think most parents that I know have been doing that as well. And I think it just validates what parents, I think, in our community really want for our children, to try to keep everybody safe. and some of the older members in our community as well. So I am a resident in Plymouth. I've lived here for 22 years almost. And I'm grateful for all of the work you're doing to try to keep our community safe. Thank you.
Thank you. Whitmore family, you had your hand up. And Kevin, you had your hand up as well. We'll take the Whitmore family first.
Hi, can everyone hear me? Sorry, I had a little, yes. Okay, perfect. I'm Suzanne Wetmore. I live in Plymouth. I just had a couple questions just because I tried to tune into the work session earlier today at 5, and it seemed like the select board actually had a lot of the same questions I had. So that surprised me. And I'm wondering regarding enforcement, fines, consequences, penalties, what might be happening with this ordinance. It seemed like maybe you don't know what those are going to be, but I'm wondering when that would get told to the public if this is going to pass. But I mostly wondered, the May 26th work session meeting is when you guys first sort of discussed this at length. And starting at minute 20 and 40 seconds, Chief Morrison came on, right, who is the health officer. And I know we heard from him earlier today, but I just feel like it's important for everyone to know that at that time, when the numbers were probably higher of COVID cases, that he at the time said he concurs with town council that if this is an overreach for anyone other than public buildings, and that it would be an enforcement nightmare and actually might do more harm than good. And then Chief LaFave echoed that same sentiment, saying that it's a logistical nightmare. He already gets over 400 calls per week for service, and that to enforce this would be a disaster. So his words, my words are disaster, his words for logistical nightmare. And so I don't know if that means we bring on more police to need to respond to more calls. I know I don't want my tax dollars going up if that is what we would need to do. So I guess I'm wondering that enforcement piece as well. I know PSU really wants this to be happening town-wide. I think, like people have already said, the town businesses, they get to choose what they want to do, and a lot of them have already spoken to that. So to wanting people to wear masks, and that people do wear masks. So I feel like between Chief LaFave and Chief Morrison both saying this is a nightmare, I don't know how we would be able to do this. And this was back when the numbers were maybe a little higher. Now the number, I know everyone's fearful, but you really can't operate on fear to mandate and have this overreach, which is what this sort of seems like. Everyone says they'll wear masks if people want them to wear masks and they get to choose. But Bill Bolton also said at 35 minutes and 25 seconds in that same meeting, he said it will really be hard to enforce if we are negatively affecting local business. And so I think and then Marianne at 28 minutes said, can we do something like strongly urge or strongly recommend? And I think has any of that happened yet? I just think there's a lot more that needs to be discussed before this gets signed. I think there's a lot of missing.
There. Sorry, can you hear me now? I have Kevin is up next. Bill Carroll's been putting a lot on the chat. Didn't know if he wanted to speak. Kevin, you're on.
Hi, my name is Kevin Young. I'm a Plymouth resident. I've been a family practitioner in town here for 39 years. I would like to make two comments here. One, I do want to express my personal value that as a community, we need to take care of each other. I think there are populations in our town that need to be taken care of and protected. Most of my workday, I see people from our community who are high risk in the pandemic. For 50% of my patients are age 60 or over. They have diabetes, hypertension, chronic lung disease, heart trouble, people with cancer, they're on chemotherapy, they're on radiation, people with immune system problems and immune system drugs. This is what I do every day, and I care what happens about them. The people at Spear Hospital and Mid-State Health Center, they care. I personally have not spoken with any single physician, nurse practitioner, or physician's assistant does not feel strongly that masking is absolutely important to the safety of our community. It's not enough to say that high-risk people should self-isolate. They're scared. They are self-isolating. There are too many of us in essential jobs. That includes medical care, that includes teaching. Now, I also want the Board of Selectmen to understand that masking can save lives. And that is based upon the community spread. Turns out that the magic number in the Plymouth regional area is 6 active cases. Active cases being within 2 weeks of initial diagnosis. That is based upon the catchment area of Spear Hospital being 75,000 people. That the statement is that masking is necessary if you have more than 1 case for 12,500 people. That means that if we have 6 active cases, that we should definitely be masking. Hard to tell by WMUR data about where we stand, but my guess every morning is somewhere between 4 and 9 cases, depending upon which month we're talking about. Now, with masking, social distancing, washing hands, avoiding crowds, and avoiding enclosed spaces, those are the 5 things. We should be able to prevent any significant outbreak. That means that we can identify patient 0, the person who starts the infection chain, and get rid of any infection in contacts. Now, patient 0 can occur from local spread. It can occur from second home people, from college people. This is something that we are at increasing risk for. So I would support this motion.
Kevin,
And thank you very
Kevin,
much.
we'll come back to you. Next is Chris Valenti, followed by Pat Berman.
There you go. Hi, everyone. Can you hear me?
We can.
We can. Hi. So I'm Chris Valenti. I've been in Plymouth for 15 years now. Also a coordinator for Pemi Valley Soda Curve Flat. We've made about 5,000 masks for the community, and requests keep coming in. So definitely I am in support of wearing masks and to help decrease the spread of COVID, and decrease the at-risk population. But I do have a question for situations where you are able to maintain 6 feet distance, especially for working out. So would this ordinance be something that's mandated for fitness facilities or places where we're working out? So just some clarification, I think, on some of the ordinance items would be great. And that's really my only question. Thank you.
Thank you. Pat Berman, you still on?
Hi, can you hear me?
Oh, I can, yes, go ahead.
Okay. Hi, my name is Patty Berman. I'm a resident of Plymouth. I have been for 27 years, and I also own a local restaurant in town for the past 27 years. I'm in favor of the mask ordinance for all the obvious reasons, but the main thing is, I know people are saying it's up to the individual businesses whether they mandate a mask or not. I have to wear masks. My employees have to wear masks. Yes, it's uncomfortable. We're running up and down stairs, carrying trays. It's hot, but we do it because the CDC says we have to, the governor says we have to do it. And we're following all the guidelines that the governor says. I can't ask customers to wear a mask because I'm already struggling to keep my business afloat. And when I say to them, you have to wear a mask, they basically turn around and say, no, we'll go someplace else. So my option is to protect my employees or to take the business. And a lot of my employees haven't been working, or they're not making as much as they were making because of obviously business is down. They want to make the money. So they're jeopardizing their health to make the money. If you mandate this, it's a non-issue. Everybody has to wear a mask when they're coming in. We're wearing masks to protect them, and I would like them to wear masks to protect myself and my employees. So I absolutely am for masking up. Thank you.
Thank you. Is there anyone that has not spoken that wants to speak? All right, we're going to go back around. There's a few people that have asked or made comments that want to speak. Where's Jesse? Oh, sorry, Jesse, I didn't see you.
That's all right.
Go ahead.
So I don't know. I jumped onto this very, very late because I'm here at the COVID site right now. I can tell you this, that we've reduced our numbers of testing nearly every week. A small percentage of those that are tested are Plymouth residents, and those are even reducing. So I really don't see the need for this masking ordinance, or definitely it needs to be refined. And also, is the town going to be the one providing masks to the public at the taxpayers' dollars? And also, I've also seen masks on the ground throughout the town. Is it my job as the solid waste manager to go tell my guys to go pick those up? So just food for thought. And that's it.
Thank you. So we're going to go back around. I have a few people that want to speak again. Your time limit this time is going to be 2 minutes. Karen McLeod, you're up.
Thank you. Can you hear me?
We can.
Okay, this has been great dialogue. I appreciate everybody's comments. I just want to go on record that I did send letters to the town administrator and select board members. And I want to articulate the importance of revisiting the 10 years, above 10 years old. That's what you're stating in the proposed ordinance. I really believe if there was ever a time for the town and the school to work together here in Plymouth, the elementary school, it's now. We're proposing that all children who come to Plymouth Elementary School need to mask up. And I just think it's important for the town and the school to work together on that. I realize we don't have to, but I just like to say that. And also, as far as accountability goes, I respect what Patrice had to say. There does need to be some kind of enforcement, but I don't know how tight that can be. But I can tell you, I have grandchildren who wear masks from ages 3 and up, and they're just fine with them when they go out and cannot physically distance. That's all. And it's just a way of life right now. So I would like to see that. I mean, I know the city of Somerville, it's a $300 fine if you don't mask up. I'm not looking for that for Plymouth, but just some kind of accountability. And it could be, like someone mentioned earlier, a parking violation fine. And maybe the enforcement really won't be so bad if we have that ordinance.
I'm sorry, Karen, we had to shut you down. Chris Sanborn, you're up next, and Magnus S., you're following Chris Sanborn. Chris, are you still with us?
Yes, I am. Sorry.
Okay.
That took me a minute. I just want to say, in conjunction, someone spoke earlier in regards to what I had to say, that I was saying the pandemic was over. I just want to be clear that I didn't say the pandemic was over. All I'm saying is that based on the data that we have, the only data we have is showing that the numbers of COVID cases within the state are declining, they're decreasing all the time. That's all we can base everything on. If they're declining based on the fact that when we didn't have a mask ordinance, why would we put in place a mask ordinance now? And I would like to speak just a little bit to what Karen said. You know, what Karen McLeod is saying is that's what the union is proposing. It's not necessarily what the school is proposing. So just to make everybody aware of that, I'm not sure of the difference with the, you know, the school board does make school decisions. Just going forward, if we've decreased the numbers without wearing masks. I'm just not sure why we would put an ordinance in now. And my biggest concern is that if we do put in a mask ordinance, how are we going to enforce this? And what is that going to do to our community? If we talk about enforcement and we talk about, is this going to be more divisive in our community than we want it? I'm concerned about that going forward across the country. Of course, there's a lot of divisiveness going on, and I'd hate to see that spread into our community. Thank you.
Thank you. Magnus with Judy DeLeo as a follow-up. Magnus? Okay. Judy DeLeo, are you still with us? Okay. Dr. Viking Hedberg, you're up. 2 minutes.
Are you there? I'm here. Just give me one moment. There we go. I just want to thank everybody's input because I think this discussion has been really healthy. I tend to agree. I do not like being told what to do, and that is really true. But we're talking of a small ask. I drive to Concord now to work. There's a speed limit. That's an ask. I could be there faster if that wasn't there. But this is a small ask. So I can understand folks saying, I don't want to be told what to do. And I'm very concerned about as far as how do you enforce this. And I think a very soft enforcement could be very helpful. It could support our businesses in that they can then request that those masks are worn. But we're not at a point we need the $300 Somerville fine, but just a reminder that that is the expectation, that is the law. And we need leadership among all of those folks who interact and lead in our community.
How to word this without.
To support the use of masks when appropriate. Thank you.
Thank you. Tristan McLean. Tristan McLean. There he is.
That in regards to asking for a mask, I, again, will repeat, I see no fault in mask. I am regularly lifting 50-pound boulders. I am literally moving dirt all day in hot machines with no AC. I am regularly walking 10 plus miles a day. There has been no side effects to my health. I think it is an egregious insult and shows a lack of consideration for the community to voice an opposition to just wearing a mask. When working outdoors, the only opportunity I see that you would have to mask up would be at an apartment complex or when you're seeing other people. When you're doing residential jobs and you're not in contact with people, that can be understood. But we're asking for those situations that I stated formerly that you wear a mask.
Thank you. Jay Robertson. Kevin Young, you're on deck. Jay Robertson.
Yes, ma'am. Thank you again. I'd like to finish my earlier comments. I'm an 18-year police veteran from the state of Texas. And when I implored you earlier to check your sources, I'm asking you to also check verification for a counter source. Find something that gives you different information. Dr. Viking, I respect what you said. There was a group of doctors testifying in the Supreme Court today that the masks do not work. They don't wear a mask 8 and 10 hours a day. So there's nothing about wearing the mask. It disrupts the natural biological respiratory process that creates in another environment and a hazardous environment by having a petri dish on your face. The last thing that I want to leave you with is that by asking people to produce papers is a HIPAA violation. You are not a medical doctor, and only a medical doctor can request that information. You're also going to incur massive legal fees by going down this path. And if that's where the city of Plymouth wants to go, I will wish you well. Thank you.
Thank you. Kevin Young, followed by George Kirk. Dr. Young. Okay. Micah. Mickleborough?
Sure. Trying to collect my thoughts here. I didn't realize I was going to be back on. Actually, can I?
All right, we'll come back to you, Micah. David, do you have anything?
Yes, thank you. I really just want to say thank you for everybody being here and allowing us all to talk. I know I have a counter opinion, but I think it's important to acknowledge that I think nobody here is speaking from ill will on both sides. And I hate to see the argument that of selfishness or wanting to hurt other people. I think it's terrible to think that somebody has a political opinion based on ill intent and malice in their heart. And I don't see anybody here, both that I agree with or that I disagree with, coming. It's really important to bring into the conversation. As far as the masking goes, I clearly iterated what the college's, how I feel the college is not a threat as per their policy. And a couple other people also talked about that. So I feel good on that point. That being said, I do think it is important. We talk about masking is temporary. Masking is a soft enforcement. Maybe it won't be much. If it's going to be soft, if you're not too terribly worried about pushing it because you're afraid people are going to push back, maybe that should be a sign you should reconsider this. Also, there has been other places that are considering making this a permanent masking, okay? And there was talk, one of the gentlemen, I can't remember his name, he talked about not just COVID, but he mentions other viruses and the other possibility of other things that may spread through droplets and things like that. This ordinance is a step towards massive overreach in all areas. There are states in this country that have made it illegal to sing in church. We have had First Amendment rights trampled, not just with facial coverings and an inconvenience, as a lot of people are putting it, but we have serious problems going on in our country. I don't think it takes a lot of time to see that there is massive unhappiness, civil unrest, distrust of police, distrust of government in general. And I think we need to be very careful about pushing that here. I do not want to see my loved home area of Plymouth known for socialism and tyranny. I don't want that. Thank you guys for hearing me. I appreciate it.
Micah?
Sorry, we got muted. Hear me? Yeah, can you hear him? Can you hear me? Anybody?
I got him on the list. I got tons more to go. Go ahead, Micah. I'm sorry.
All right. Yeah, thank you. I think I'm going to go back to the fact that, one, the masks don't work. It's proven that they don't work. I ended my point the last time with the fact that this ordinance, which one, I heard that, Mr. Tyrell hadn't even read it. This is in front of all of us. You guys didn't even look at it. We read it. We even had a rally about it. Okay? It's government overreach. It is small town overreach, but it's still government overreach. You guys don't even probably understand what permeable means, or this wouldn't even be on this ordinance. You just copied it from Nashua. That doesn't show that you did any research whatsoever at all. And that is kind of disturbing, being that you're supposed to be leading our town. All right? So I pay my taxes here. I live here. I would like to see people actually pay attention, especially if you're going to lead this community. All right? Because obviously you don't need to be leading, you don't need to be select members if you don't even know what's going on, which was very clear that you didn't know what was going on. All right? So, and it also states at the top of this that the Plymouth Selectboard is hereby approved for this ordinance. So you tried to already say that it was approved. People found out about it, and here we are. We're voicing our opinion, really hoping that you have taken the time to listen to us, because it's very important to listen to the people that voted you in and that pay the taxes in this town. Thank you.
Thank you. We have a response to that from Zach Tyrell.
Yeah, so I just wanted to clarify just a few details since you mentioned me specifically. I have in fact read the ordinance as proposed. I read it as soon as it was made available. There may be a detail that the community doesn't understand about the process. Select board members are not allowed to deliberate on policy in private. We can't have a conversation. We can't share an email. We're not allowed legally to discuss anything in private unless it very specifically meets an RSA that allows us to discuss it in private. So today was the first opportunity that the select board had to look and talk together about this proposed ordinance. We're not intending to vote on it today. We're collecting and soliciting information from the public. And if we choose to go forward with the ordinance, we'll adjust it based on feedback and then go from here. But we have to start from a draft. So one of the select board members put forth this draft that was modified from the towns of Nashua and Newmarket. And we're going to continue to either iterate on this or throw it out. But we can only do that in public. We can only do that in the public light. We can't have those conversations legally in private. So what you're reacting to is a draft ordinance that one of the select board members put forth, that tonight is the first legal opportunity for us to discuss the details of.
Thank you. Tom Morrison.
Thank you. I just wanted to respond to the comments about the May meeting. At that time, we were relying on an opinion from our town council. Since that time, as we know, some ordinances have been upheld, others remain in challenge. And I still think it will be an enforcement nightmare, as I said back in May. But as we all know, it's a fluid situation, and I think we should all keep an open mind, and I certainly intend to. Thank you.
Thank you. Mike's son.
Sorry, I just had that question. I wasn't planning on speaking, but I was just wondering if this ordinance is passed, how long it'd be in place and when it would get lifted. Or is that part of it, or is it just going to be in place permanently? Or because I honestly, from my professional experience, I really don't see this pandemic disappearing next year. It's going to be with us for a while, and especially with flu season coming around the corner. This, I think, again, I'm just going to say that I'm strongly support this ordinance. But that was my question.
Bill?
Yes, so actually I want to thank Zach for a very good explanation of what we actually are doing tonight. And also regarding the end date, there was no end date in the ordinance. Obviously we could end it with a meeting. There was an ordinance that did include an end date, which I was kind of intrigued by. And then similar to the governor always putting an end date on like stay at home, and then just prior to that date would then without 3 weeks, or so, we could do that as well. But yeah, I mean, the end date, we can end it pretty quickly when we need to or want to.
So the last one for this second round is Laurel Sean.
Yes,
Laurel.
hi.
Hi.
Yes, hi, thank you. I did just want to have one more comment real quick. I do feel like, if this is passed, that the asking for papers to prove that you have some sort of medical issue is a clear overreach. I think that is not necessary. It's just going to be embarrassing for the person, and it actually will put the people who work at the restaurants and the retailers in, I think, a position they probably don't need to be in. I don't think that that's necessary, and quite honestly, I think that's an invasion of privacy. I also think that someone mentioned it earlier, that will this result in negative consequences? Some were already talked about on this call, and public shaming is going to be one of them. It's already here in Plymouth, and I'm going to share a quick story for people to consider. I was at Market Basket doing my grocery shopping. I had on a face covering that meets the guidelines proposed in this mandate as well as CDC guidelines, and I was stopped by a woman who said, "You should wear a mask." I was appalled, and I think that will happen a lot more in our community, because why aren't you wearing your face mask? Well, it could be someone who is ill, who can't wear one, or you're not wearing the right face covering. Your face covering, it will cause things because it's already here. Thank you.
Thank you.
And I have a comment.
Go ahead.
too. I'd like to speak again.
I just want to thank everybody. I personally want to thank everybody who participated in this hearing. And from my perspective, we haven't made any decision yet. We just want to hear from everybody, and we want to weigh all the testimony and give it a fair hearing. Thank you.
Thank you. Malik Hammond.
Hey, again, thanks to Zach for the clarification on the actual fact that this is not voting, and that this was the first opportunity to have a public speaking, as was mentioned to me at the beginning of the meeting. My question really is that I'd like a response to is if there is a follow-up time frame for this that I did not see, as far as when a more permanent proposal or official proposal would be put forth, and that would, in all hopes, have some more clarification on things like indoor dining, and also for Mike and David as well, outdoor work where social distance is an opportunity. Lastly, before I get that answer, I just, for my personal 2 cents, I think enforcement should not be something that is shied away from. I think, if anything, to be totally blunt, it's an opportunity for revenue, just like any parking ticket would be. There really shouldn't be a challenge with enforcement component, in my opinion. So thank you. And thank you for the work you're doing.
Steve LaFave, Chief.
Since I've heard everybody kind of talk about enforcement, I'd like to speak on that. And my personal feeling is, David said it very eloquently earlier. I just don't think people are that kind to each other anymore. So given the public sentiment on both sides of this issue, enforcement of any type, I think we're going to get some undesirable consequences from that. That's my biggest fear with this whole thing. Because people nowadays just aren't nice. You just heard the other woman speak about the public shaming. It's going on. This is going to be logistically a nightmare. My department is already handling somewhere in the neighborhood of 400 calls for service a week. You divide that by 12 of us, that's a lot of calls. We are busy, and we're already getting mass calls as it is. I just was on the phone with the Attorney General's office just last week because there were several businesses in town not following Governor's Order number 52, which is all of their employees have to wear cloth facial covers. And I told the Attorney General's office myself, yeah, we're not gonna go check that. I was told outright, yes, you have to go check that by the Attorney General's office. That is your job. You have to go do that. So logistically, I think this is going to be a nightmare. Other things people should know, we stopped doing motor vehicle unlocks. Why? Because we have so many businesses in town now. We were doing dozens of them a week. This is all we're going to be doing. I am not for this ordinance. I am not for forcing it on people. I suggested we do something along the lines of what Keene did, and mask up Keene, and they're having success with that. If you talk to people down there, their businesses got together and decided to enforce it themselves and all make a rule. And I heard a couple business owners talk as well that, you're afraid to either lose your business or afraid to tell people that, hey, excuse me, sir or ma'am, you can't come in here without a mask, but you want the town to pay for that for you, which I don't think is fair to the town either. That's all I have to say.
Steve, that Keene is going forward with an ordinance that's going to be mandatory ordinance as well. And primarily because they're one of the towns that are going to be inheriting, half their town in students. So
And I don't know, have you seen the letter that the Keene chief gave to the town manager?
No, I did not.
Okay, I'll send that to you. He speaks against the ordinance as well. So there are several chiefs out there that are against these face mask ordinance, myself included.
I would sympathize with the enforcement nightmare. I really do. I do. So,
The next one that I have, one person who has not spoken is Jennifer Deslodges. Loge. Sorry. Jennifer, there she is.
Hi,
Jennifer, you got 3 minutes.
Hi, I'm here. I wasn't expecting to speak. I just wanted to say that I'm very in favor of this ordinance. I think of it as being very similar to the ordinance that says you can't smoke in public. Secondhand smoke causes problems for other people, and it's one thing if you know you're hurting yourself, but if you're hurting other people, that makes a whole different thing. And I wonder what would happen if I were in a downtown restaurant and I started smoking inside. I wonder what would happen there. I am part of a vulnerable population. I have a husband who is at high risk, and as far as divisiveness is concerned, I guess it's already divisive. I already see people not wearing masks, and it really bothers me. If I or my husband get sick, we will likely no longer be residents of Plymouth. So I guess that's all I have to say about it. Thank you.
Steve?
I just have a follow-up to that. We already have a mechanism in place. If you're in a restaurant and you're smoking, and the rule is obviously you can't smoke in there, or you have a mask, and the business doesn't want you in there with a mask, it's already a mechanism. If you refuse to leave, you call the police and we come and we remove you. You've been told to leave because you don't have a mask, and now you're getting into a criminal trespass, which is an actual law, not just an ordinance.
Yep.
Chairman, I have several people that are starting to raise their hands again or asking for additional time. Is there, at what point do you plan on closing your public hearing at this tonight?
I would be, no offense, George, but I'd be kind of comfortable in closing it now. I think we've heard. All.
I don't believe George was allowed to speak twice, and everybody else was. Am I wrong? Did he speak twice?
Same. I'd like to hear what George has to say.
He did speak twice? Okay.
I believe he did.
I did not speak twice.
I called your
did
name,
not
George.
speak twice.
You are correct. I called your name. You were gone.
Thank you.
Well, he's here now. Can we hear from him?
I never left. I've been sitting here.
I've seen his face the whole time.
You got 2 minutes. Go for it.
2 minutes.
Thank you. The first thing I want to say is to the people of the town, the select board, everybody that works for the town, I understand you guys are trying to make very tough decisions with the information you're being given. It's not an easy task. You're trying to protect the town. But I really hope that you take the time to look and see how faulty the information that you've been given is. Because the proof is coming out that it's not what they think it is. You know, I know everybody's going to say I'm wrong, but I'm not. And I am 110% with Steve. His job is tough enough as it is. To ask them to be the mask police is just crazy. And again, I'm not saying if somebody doesn't want to come to a business that doesn't have a mask, that's their right. But it's also my right not to wear a mask in my own place if I don't want to. And I think it's definitely an overreach. And yes, there are teams of attorneys across the country that are waiting to pounce on these things. I don't think we need that. You know, it's again, it's a very tough thing that everybody is trying to deal with. But fear is a very bad motivator. Don't make your decisions based on fear. Make it based on proof of what is out there, and make sure you get enough evidence, real evidence, not fabricated. You need to research it and come up with it. You know, again, I respect everybody and I appreciate what you're all doing and why you're trying to do what you're trying to do. But I definitely don't agree with it. I think it's not necessary. And if I have to wear a mask to go out to dinner, I'm just not going to go. Doesn't matter where it is. That's all I'm going to say. Thank you.
Good. Thanks, George. And we are in the middle of a public health crisis, and we are given more latitude to do some things that, you know, might not be, you know, entirely justice. In what I'm getting at is the courts would forgive us a lot because we are in the middle of a public health crisis. That's what I'm saying. And we appreciate your input, and I think what we'll have to do is just go back and answer the questions that have been given to us and clean up the ordinance. Well, we'll let the board meet on this one and see how best, if we need to clean it up, we'll clean it up. If we need to modify it, we'll do that as well. One thing that does allow us to do in private, which is not a public meeting, is to meet with our attorney as well, and that's under client, what's the client attorney privilege, and we think we might have to do that. At least that's what I'm thinking, to see the legality of what we may need to change, and basically get it, some, I get clarification on his part. So Kathy, I'm going to have to ask you to set that up, maybe.
Okay.
And see when the board might be available, maybe even by phone. And then we'll have something to produce for our next meeting on the 11th or the 10th. What is it?
August 10th.
Okay. And I guess that's pretty much, unless, does the board have any more comments?
Bill, I got some questions answered during the work session, but the health officer under RSA 147:1 is a drafting authority for health-related ordinance, and the health officer and the police chief are against mandatory masks, as they have been in previous meetings. Now, we talk about the select board meeting. However, at the last meeting, we didn't discuss masks. 6 days later, I come in, I get a call from somebody saying we're having a public hearing and we're going to vote on a mask ordinance that I had not even seen. In the last election, everybody was talking about transparency, what the board is doing behind closed doors. Well, all this was brought forward without, at least I wasn't. I don't know who else was contacted. I didn't even see this. I haven't even talked to another selectman because we need to do this at meetings. But, I just feel like, we've got caught with our feet on the floor. We should have done some more work on it. To my knowledge, the college is going with mandatory masks. We heard that. That's what's going to happen. We're not having any more cases. We have 200 to 300 visitors in the last 4 months from Pennsylvania, Florida, every place. I mean, if the merchants want to have mandatory masks, they can do so. I go to Market Basket. I have a mask on right now. If somebody wants me to put it on, I put it on. I'm respectful for those other people. But when they're going to tell me that I have to do it, I mean, I don't have to go to Market Basket. And, if they want it and I need to go there, I mask up. And I do mask up because there are other people there and we need to be respectful. But in the common areas, I just kind of have a problem with it. 78%, and I don't know whether people know this, 78% of the deaths, or approximately 145,000, were in nursing homes. This means we've lost approximately 32,000 people to death in non-nursing home settings. In 2018 and 2019 flu season, we lost 50,000 people to the flu. During the pandemic, we say necessary businesses are liquor stores. They have to stay open. Alcoholism kills 88,000 people a year. The ordinance suggests at this point that we're no longer capable of thinking for ourselves. It suggests that we're not capable of acting in our own best interest or in the best interest of others without the order from the select board. And to me, it's an affront of our intelligence, and It's a gross, to me, it's a gross overreach into the control of our daily lives. Thank you.
Thanks, John. Do I hear a motion?
You want a motion to adjourn the hearing?
I think we already closed the hearing, didn't we? Or
Close the
Did
hearing?
close the hearing, yep.
Yep, so I'm looking for another motion.
Okay. I move that
Make a
we-
motion, we adjourn.
Thank you, birthday girl. Is there a second?
I'll second.
All right, Mary Ann moved, Zach second. Zach, your vote.
Aye.
Mary Ann,
Aye.
Neil,
Aye.
John,
Aye.
Bill, aye.
Thank you.
Thank you.
Thanks, everybody.